afternoon. My name is Amanda and I'll be the nurse taking care of you today. Can you state your name and date of birth for me, please? Okay, thank you. And then is it all right if I take a look at your ID band just to verify your identity? All right. I'll just go ahead and move the blanket right over here. I'll take a look. Okay, and that matches. Thank you. So today I will be placing an NG tube in you. Let me get some gloves on first, and then I will explain the procedure. All right, so this is an NG tube, and what this does is this tip right here, it'll go in through your nose, down your throat, and then until it rests in your stomach. And the purpose of this is just so that we can feed you and give you meds just directly through this tube. So before I put it in, I'm going to measure how much of the NG tube I'll be needing. So let me place you in a high Fowler's position first. Right? And then I'm gonna start right over here, put this down. So start at the nose. I'm going to loop it around your ear. Go down the throat. This down, and I'll keep going until I feel your sternal notch. So that puts it at right around 65. So I'll be placing this towel on you first. Place it around your neck. And then before I put in the NG tube, I'm just going to lubricate it with a little bit of this lubricant right here to minimize resistance as well as maximize your comfort. Right, and then before I put in the tube, I'm just going to bring you forward a little bit, and then if you can just please tilt your chin down just to close your airway and ensure that the NG tube will go straight down into your esophagus. Right, I'm going to stick the NG tube into your nose now. And then as it approaches your pharynx, you might feel the need to gag or cough. That's totally okay. Just start and keep on swallowing just so that the NG tube will eventually reach your stomach. Thank you. Keep on swallowing, please. I'm almost at the 65 mark. All right, that leaves it right around in there. And then I'm going to fasten the NG tube with a butterfly bandage. Right, and then I'm just going to pull out the guide wire so that we'll be able to feed you and give you your meds. Alright, so shortly you will be fed and given your meds, and I'll be back in a bit to remove that NG tube. I will also call for an x-ray to confirm the placement of the NG tube in your stomach. Please call us if you have any complications. Hello again. So the other nurse just informed me that you have been fed and your meds have been administered. So now I am going to remove your NG tube. So let me put on a new pair of gloves. Alright, so before I remove your NG tube, I'm going to lower the head of your bed a little. Alright, you can go ahead and relax. Okay, and then this is just to make sure that your airway is opened up and it's easy for me to remove the NG tube. So I'm going to start by removing the butterfly bandage. Alright, so now I'm going to remove the NG tube. Normally in this process, if I feel any resistance, I would immediately stop and call for help. And the same also goes for when I'm putting in the NG tube. So if I feel any resistance, again, I would immediately stop and call for help. So could you tilt your head back a little bit for me, please? Right, and then as I remove the NG tube, just please take a deep breath. And I'm going to start, 1, 2, 3. All right, so the NG tube has now been removed. I'm going to wipe up a little bit of the lubricant that got around your nose. And that should be it. Please let me know if you have any questions or concerns. Have a good day.